Good afternoon, everybody, and thank you for attending this webinar this afternoon in what's, I think, proving to be a very strange time in everyone's working lives at this minute in time. So I hope everyone is well, and yeah, welcome to this webinar where we'll be discussing business continuity planning and giving some insight from some of our members and from some of our experts into kind of how they're dealing with the situation at the moment, and what business continuity planning is all about and how best to cope. So I think at this minute in time, I will hand over to Brian Runtsman, who is BCS's Head of Content and Insight, who will be presenting and chairing this webinar. So over to you, Brian.
Thank you very much, Simon. So just to introduce our panelists, we have Dr. Patrick McConnell, who is an academic. He's an expert on risk. He recently wrote a book, Strategic Technology Risk. He's on here partly because he wrote a really popular article for the BCS website on business continuity recently. Thousands of views just over the last week, perhaps not surprising in the current climate. We're speaking to Stephen Slough, the CIO at NHS Dorset, and also Paul Newman, the CIO at the Royal College of Nursing. So we're really pleased to welcome you, gentlemen. The approach we thought we'd take today is from the three pillars of cybersecurity, really: people, process, and technology. They're a good basis for our approach, I think, today, although it's not specifically about cybersecurity. Not long ago, business continuity was viewed as having a big building on the outskirts of a new town with 500 empty desks ready for people to jump into. Things have changed somewhat. In fact, just some background on today, we had some more people lined up for this panel from utility, finance and business as well. But such is the nature of this situation at the moment that, as you can imagine, things have changed somewhat. So we're really appreciative of the three panelists that we have. So we want to take stock of where we are now, share some learned lessons, and of course the backdrop for us is that BCS, our tagline is making IT good for society, and this couldn't be any more apposite right now. So first of all, part one, I'd like to just speak to Patrick first. Patrick, can you tell us a few of the principles behind your excellent article about planning for a pandemic? The contention is that business continuity plans are perhaps not as resilient as they need to be when something actually kicks off.
Yes, indeed. Thanks very much for asking me along today. Just a quick little bit of background before we go on. I'm in fact an IT professional. I have been most of my life. And the interest in pandemics came about whenever I first had developing a new communications and call center system for a small Australian bank. And that happened to coincide almost exactly in 2005 with the outbreak of the avian flu, which is a H5N1 virus. That really didn't do too much. It killed quite a few people, but didn't sort of make the headlines the way the current coronavirus has occurred. And it occurred to me, looking at with my BCP hat on, that pandemics were very different to other types of BCP events, floods, earthquakes, that type of thing, in that mostly the technology would remain pretty well in place, but it would be the people who wouldn't be available. And not only the people in the IT sense, but the people in the business as well. So giving business people access to IT became very important. I then subsequently, on some of my courses on strategic and technology risk, on virtually all of them, I ran an exercise for people on a hypothetical pandemic for a number of years. And it was very interesting to get their feedback as to how a pandemic would affect them, and that really forged some of my thinking around pandemics. I wrote a paper in 2005, and the latest paper I've just updated with some of the thoughts on that. So really it comes from a little bit of experience with pandemics in the past, but a lot of thinking on what to do if it happens. And the key point is, how do you organize your people to support your business? And I've come to the conclusion that attempting to support business as usual is pretty much unsustainable. And what you have to do is you've got to pare your business down in such a way that it's called business as survival, as I call it. And not only sending people home, not only having them work from home, but also basically putting some people on the bench so that you're clearing the decks to do real work to survive the business. Does that make sense?
It does. So you were talking in your article about the corporate governance approach that's required.
Yep.
Can you give us a few tips on that?
Well, fundamentally, you have to have some corporate governance. I mean, it's sort of dead obvious that you have to. And with most corporate governance, it really doesn't work unless it goes to the very top of the tree, the board and senior executives. And first of all, what you have to do is you basically have to recognize, as with all disaster, business continuity planning, disaster recovery, you have to realize that it requires a lot of effort, focus, and money from the top of the organization to do it properly. And one of the problems with BCP and a lot of other technology areas is that it goes off the boil after a while and people stop spending money on it until it's absolutely necessary. And unfortunately, we're finding now that lack of investment has really caught us on the hop. So, so one of the things we have to hammer home is that a couple of points: pandemics are inevitable. They don't come once 100 years. They come once every 10 years. Some of them are not as big as others, but they're inevitable, and they're very difficult to stop. Okay, you can't stop them, especially if the virus itself is not too infectious. So you've got to do that. The next question is, how long will a pandemic event last? And in the paper, I've drawn a diagram which somebody once called the circus tent diagram, which shows how pandemics typically evolve. The problem is that you can't put real numbers around the different phases of a pandemic, so you've got to get them in range. And currently on the diagram it says probably a pandemic will last somewhere between 12 and 15 months. And I think what's happening with this particular pandemic, it's panning out that way. So what you have to get is you have to get the senior people in the organization to understand that a pandemic is not going to go away anytime soon. It's going to last for a pretty long time. And in fact, I keep using the phrase 2020 is toast. You may as well forget about your carefully crafted strategic objectives. 2020 is going to be all about, particularly for large organizations, it's going to be all about surviving until you get to 2021. And some of the key... Sorry,
carry on.
And it's absolutely essential that senior management do understand that. And some of the corporate governance things that has to happen is you have to identify an organization at the top of the organization, which I call a pandemic planning and coordination unit. It can be called whatever you like, but there has to be something there that will take over day-to-day running of the pandemic response by the organization. And that has to be staffed with a whole wide range of skills. I mean, looking at your people, processes, and technology headings, which are very good, it's got to have technology experts, communications experts able to get messages across to people. It's got to have IT experts, people who will build websites and keep the system going. It's got to have telecommunications experts, because telecoms will be the currency of keeping the system alive over the 6-9 months, whatever it's going to be. Security experts are very important. And then you need medical expertise. You've got to somehow get access to people who will give you a clear, concise, and objective information on what's going on so that you can make decisions. So once you've got those people... Sorry,
carry on.
So once you've got those people in place, then you have to start doing education, teaching the senior management what a pandemic is, what it will involve, and what the reactions have got to be. And then you've got to put in place a load of things like policies for operating in the event of a pandemic. It's a bit too late to start doing that now. It should have been done before, but we are where we are, and so it's got to be done as quickly as possible.
So in your piece, you were talking about the fact that some elements can be de-emphasized. You mentioned IT architects and strategists in the long term, in the short term, rather, may be able to stand down. Is that a difficult management area there to sort of prioritize functions?
I think that'll be the key decision that will make or break a firm's response to the pandemic. A clear understanding of which parts of the business are absolutely important to keep the business alive, to keep it surviving. A clear understanding of those functions which are not needed today and may not needed be for 6 months, sorry. So I use examples like IT architects. I mean, I used to be an IT architect myself, so I'm not in the least denigrating them. But, IT architects could quite easily go home and work for 6 months on ensuring that the current architecture is well documented, it's solid, risks identified in it. They basically don't have to turn up to work every day for 6 months. And there's quite a few people like that. So it's not really de-emphasizing. It's, if you like, I'd turn it around the other way. It's emphasizing, getting everybody on board on what the most important parts of the business are, and focusing on that.
That's been a great start to our discussion. Thank you for that. So let's bring in Paul and Stephen now, because obviously you're dealing with this stuff now on the ground. Can we ask you, first of all, well, perhaps let's ask Paul first. What's been the impacts on your specific functions, help desk, the IT department, your security operations, and so forth?
Yeah, really interesting debate and some really good insights there. I mean, the key thing for us is very much about people. And we're finding the challenges that we've got is around that knowledge, the expectation on technology, and obviously the staff that support the technology. Those are the biggest challenges for us. When we're talking about prioritization and functions and roles and responsibilities, the question that we asked very much is, what are our business critical functions, and in what order are we supposed to be delivering these business critical functions? And that's really where we need to put our concentration on in terms of channeling that resource within that. In terms of impact around staff, I think we're fairly well geared up as an organisation, thank heavens. We have all of our service desks now working from home. So we're supporting our business and our organisation with our staff at home. All of our development team, they're all at home. So every function that we're able to run from home, or from any other location actually, we are doing so. Obviously, there needs to be some physical people on the ground. The big challenges that we're finding at the moment is the logistics of actually getting equipment out to people. All of a sudden, people realizing, oh, I need a laptop, where perhaps they've been in that mentality of working in a fixed location via a desktop. So trying to switch that mindset. And I think the organizations that perhaps are more forward ahead in their thinking and their ways of working around more greater flexibility will obviously win in this scenario. We are finding challenges around things like supplier chains. So, if you're struggling to get hold of Blue Roll, you'll also struggle to get hold of laptops right now. And that's exactly what we're finding. So big challenges around that. And then when this equipment does arrive, it's got to be configured, it's got to be rolled out. Then you're giving it to users who aren't au fait with working in this way. So then there's a big kind of knowledge gap that you need to support. There's that initial support in that whenever you give something new, you're going to have a couple of niggles. And then there's obviously that ongoing support. So my mentality was very much about, following that kind of government trend is how do we stretch this out in terms of the resource that we've got? We know we are going to have an initial upsurge in terms of expectation, but that ongoing support is also going to be a requirement. So the first thing that I said is, listen, we need to isolate this staff in terms of the resource that we got to make sure it's available for as long as possible so that we can support the organisation for as long as possible. And that's why we immediately instigated everybody working from home to isolate everybody from potential illness. There are some big challenges there. But again, as I said, I think the organisations that are further forward in terms of their adoption of flexible ways of working are the ones that will win in this scenario.
And how are you finding things, Stephen?
So I'd absolutely agree with what Paul's just said. I mean, particularly on the hunt for kit at the minute, it is like the digital version of toilet roll, I suppose, at the moment. There's just not enough of it out there, and whenever anybody finds some, I think they're buying up everything they can. which does absolutely have a knock-on impact then of its supportability, because you end up with kit that you don't necessarily have a standard image for, so all that sort of thing has to be reworked. It's unfamiliar to the support and the users. So yeah, there's all sorts of unforeseen impacts, I guess, that are coming out from this. And a bit like Patrick mentioned earlier, we're not really prepared for all the workforce disappearing. Normally it's a building going, lots of services being offline, and in this situation all the services are online. Everything's working actually pretty damn well. Just there just aren't necessarily the people in critical roles. And we have a similar situation in a number of our organisations here. We've got support desks being run remotely. We're having conversations between NHS organisations about sharing key resources, particularly around telephony, network support, and around some of the security specialists as well. So in the event that somebody goes off and their organisation doesn't have that critical function anymore, it's how can we share the resource we have across the ICS. We've also taken the step of identifying members of our staff who have underlying health conditions, and they've already gone home. So we very early took the step to protect them and start to put in place rotas and things like that for on-site support. One of the additional things which we haven't really practiced for or thought about is for ICU and high dependency units now, we absolutely have to make sure the technology keeps working in those spaces. So it's about making sure our engineers have got access to suitable PPE when they go in there to support the clinicians and the care workers properly on the front line with what they're dealing with.
I mean, that brings us, I think, neatly on. Sorry, carry on.
I was about to say, absolutely. There are, with your ICU people, there are IT people that have to be on site, and they have to be looked after, and they have to have the equipment necessary to ensure that they are looked after. Different problem when the people are off site.
Yeah, it totally is. And we're, lots of attempts now to put more and more remote consultation functionality out there, both for outpatients in an acute hospital setting, but also ramping up in mental health and for GPs as well, of course. So people that don't actually need to be sat physically in front of a clinician now. How do we accelerate plans that were already in the pipeline and oddly were due to be getting larger in this coming next 12 months? Now we're having to do it in the space of a week or two. So there's quite a lot of challenging. All the while some very helpful people out there in the wild are trying to hack us, even more than we've seen in the past, and a huge upsurge in sort of suspicious emails with dodgy links coming through or being blocked in the main by security software. But it's just incredible people trying to take advantage of this situation.
So that was another question I was going to ask about the security side of things. Paul, have you got anything to add on the security implications of this sort of migration of workers?
Yeah, I think I'd echo some of the comments just made. The number of people that are jumping on the bandwagon in terms of taking advantage of what is a vulnerable situation. Professing that they have the answer to this pandemic that we currently find ourselves in. It's about being vigilant. The other thing, again, it's about data and data protection. Now our data is elsewhere. And we need to make sure we've got the proper systems in place to contain and control that. Luckily in the setup that we've got, we have a system where we have the data in a single location. But again, I could imagine that's some big challenges for some organizations. How do you get access to this stuff? And then as a result of that, IT security starts to lessen in order to make accessibility easier. It's a big challenge. But in terms of how we're finding it personally, I think we've got a good handle because of the way we've built and designed things. But I could imagine that's not the case for everybody.
Absolutely. So a related subject then, but we're still talking about people. The other thing that comes into it is that people are now going to be working on their own. There's well-being issues, mental health in general. What sort of approaches have you got in mind for dealing with that, for support for those that are working remotely? Perhaps I can start with you, Stephen, on that one.
Yeah, sure. So it's got to be around keeping in touch. I mean, more people are working remotely, the more you need to give them that, still got that sense of belonging to the team and to a group, and make sure they're focused on the tasks in hand. that are critical to keeping the operation going. So there are lots of formal options that we've got. We've got Teams, we've got Skype, we've got email, phone calls, are the usual ones we have deployed everywhere. But then we're also looking at some of the informal ones about Facebook, Messenger, use of WhatsApp and things like that, and really making sure communication is still there, making sure people still are on focus, on topic if they have something to focus on, and if they are in a role which means they can't carry on with their primary role, it's where else can you give them a task, where else can you make them feel useful and get them engaged.
Thank you, Paul. What's your approach to that?
Yeah, but pretty similar to what was just mentioned. I mean, I think the key thing in this is communication. You know, we have arranged daily briefing calls, so we have a daily briefing call with our executive team. So that's coming from the very top, from the chief exec downwards. Then that's followed on by a management team having a briefing call as a management team. We have a WhatsApp group set up for all of our IT staff. So it's much easier to basically communicate en masse. And I make sure that there's a daily message that goes out, keeping the team informed. You know, but people's mental health and well-being, I think, is of utmost importance in these times. You know, being at home, staring at four walls, you can drive yourself insane. You know, so I have pushed messages out to people that, you know, I do expect managers to be able to contact staff on a regular basis just to check in on people, make sure that they're okay. I think the art in this is people want to know, they want information, they want to be fed information, and in isolation of that, then fear and angst starts to set in. So the counteraction to that is very much about telling people, giving them those messages and checking in on them.
Lovely, thank you. So we've discussed a little bit of people stuff there. Let's look at, perhaps we could just change track to process a little bit more. So your organisations will have had some business continuity processes in place. Can we ask you, and be as honest as you feel you can be, how the reality has differed from the plan? Stephen, could we start with you on that?
Yeah, so differently across the different organisations that I'm responsible for. So in the primary care side, lots of investment gone in recent couple of years. Technology's up to date. You know, Windows 10, Office 365, all that kind of stuff is already out there, already quite well entrenched and in use. And that's gone quite well. It's been relatively straightforward now for us to roll out a faster remote consultation piece to support the GPs at home and things like that. Where in other organisations there's been less of an investment in the technology because we don't have parity across everybody, then this is more difficult. And we are now suffering from that historical lack of investment where benefit was taken in the past for saving money is now catching up.
Right.
Investment is now needed, and as we discussed earlier on, you know, the kit just isn't there in the supply chain if you need to get hold of it. And with reducing workforce numbers and changing priorities, it's going to be harder for them to respond. So they've definitely got more of a challenge there. But in the main, as I mentioned earlier, that most of the planning is around being unable to get into a building. In this case, it's more about how do we enable people to work further away from that building for what could be a very sustained period of time.
Sorry to interrupt. It will be a sustained period of time. I think that's what people don't realize. This is not going to be short, and people will be working away from the office for a very long period of time, and not all people will work to their most effective when doing that.
No, I absolutely agree with that. Yeah.
So, Paul, have you found a similar thing? I think people might be surprised to hear that some of the issues with the business continuity has been around the hardware, which tends to get relegated in people's minds now. It's just, well, that's always there.
Yeah, I mean, it's really intriguing, I think, and I think where exposures are shown is where people perhaps haven't tested their business continuity planning to great effect, and those weaknesses will now be shown. And again, it's that mindset shift that because you come into an office every day, that's the mindset that you're within. And you kind of put that thought of, oh, hang on a second, if I wasn't able to work in this way, what would I do? And some people simply haven't thought about that and are now being caught out as a result, you know. So that's where that pressure on hardware, for example, has come from. You know, we've rolled out 125 laptops in 1 week. The pressure that put on the support team to do that is immense. They've responded fantastically, to be fair to them, but it's then that expectation in that people haven't pre-thought these things. They simply don't think it's going to happen. It's not going to happen to me, sort of scenario. So it's I think very chilling to hear. When you hear that this will be a sustained length of time. It's not an if. It's a will. And the people that have tested or pre-tested, are very well prepared for that. The people who are in that mindset of it's not going to happen to me, and I'm quite comfortable sitting at my desk every day, are the ones that are going to be caught out. And we're finding that at the moment. So there's this mass panic now of, I need a laptop. I need to be able to work from home. I need multi-factor authentication set up. All these sorts of demands that come, and there's limited capacity to deal with that. So we have to prioritize. And then the people who are further down the prioritization list, their angst and their pressures build up because then they're not getting the immediate response that they now think that they need. Those are the challenges we certainly find it.
That's interesting. Are there things that in a very short space of time, as this has developed in the last even week and a half, that you've had to adopt very, very quickly or change in your approach on the fly, Stephen?
It's more about the remote consultation piece. So as we're having the conversations with GPs, with doctors in the acute hospitals, and then with the mental health physicians and community nursing, these people are going to be seeing ill people potentially that have the virus. They will potentially be ill themselves and need to self-isolate for an extended period of time. So how do we make sure the capacity stays in the system for their specialist services to stay available? And that sort of remote consultations is a big tool in the armory, really, to enable that. We've been trialing something for a little while in the community and mental health space, and we created 18 new waiting rooms for 900 GP staff on Friday last week, just to get them ready for Monday morning, so this would all be available for them, and it's now being used with quite a degree of success. I think there's excuse me, I think as Paul mentioned earlier, there's the issue around training. How do you get out to all those people in all those far-flung areas around the county and make sure they're all trained on this new technology? Pushing it out to the laptops is pretty easy by comparison, but we're in the situation now where everybody needs it. They need it now. We also need to tell them how to use it. So that usual managed approach to deploying a new piece of software is kind of to a degree around the window, and you're having to be more flexible.
Stephen, have you found any telecommunications problems, bandwidth and that sort of thing, being in a rural area?
Yeah, definitely. So we struggle with that anyway. It's all well and good if you're in a city in a built-up area, but we struggle with high capacity bandwidth to some of our more remote practices all the time. We're doing as much as we can now to reroute traffic across major connections in more urban areas, and then use the NHS network across the backbone, if you like, to route the traffic in a different way, but breaking out to the internet through some much larger pipes.
Interesting.
You get to be more creative in these times of pressure, I think.
Absolutely. Paul, have you found anything you've had to change really quickly on the fly, or any new tech you needed to adopt or approaches?
I think the thing for us is that we were in the midst of rolling out Microsoft Teams in replacement of using Skype, and that we had a roll-up plan. We're in the midst of doing this. The prioritization focus of that has now dramatically changed. Almost we've ripped up that plan and thrown it out the window. We have to rethink and restart. The reason why we've done that is that Teams offers a lot more kind of collaborative tools, that ability to kind of come together, and we've seen some big advantages, particularly for senior execs, for example, to give them those facilities. So that's been the biggest focus for us. Again, picking up on Stephen's point, around that kind of capacity issues. I don't think it's unique to those kind of low broadband areas. I mean, the whole network is now going to be under pressure. I think that one of the biggest risks we've got is that we are so heavily reliant on broadband and network capacity, for example, that if anything should happen to that, we would be in a lot of trouble, I think, to put it politely. that does worry me slightly. I mean, particularly at the moment we're coping, it's getting there. But you know, as this thing ramps up, the ability to maintain and support that and the reliance on it is only going to increase.
One of the issues that was raised as a question was what types of risk are you trying to cope with? And of course, telecommunications will be one of those, because when people start working from home, the telecommunications system will really start to creak. And unless you've got dedicated bandwidth, it's going to be very, very difficult to keep your operations operating business as usual. No?
I completely agree with that. It's. I mean, we're already seeing delays on receiving emails, for example. You know, we're running 365, so we've got Exchange in the cloud, and you will see delays in that on times, not all the time. But you know, you do see spikes in pressure, and I just envisage that's going to get worse.
Patrick, can I ask you to set the scene in terms of pressures that we're going to see in the nearest future? So bandwidth is one of them. What other things should we be expecting over the next 2 or 3 months?
I think well, the people thing is quite important. I think not everybody works well at home. It's all very well that people put their hand up and say, I can work from home, but actually organizing to work effectively from home, especially if there are young children around off school, is going to be quite difficult. So I think the people issue will not be so much around loneliness. It'll be, oh my God, can I get back to work because I'm doing so much at home. Then it probably hasn't started to hit yet, but then down the road, some of the processes that definitely in the medical area, some of the processes which require people to be close to each other, authorizations, discussions around, for example, some bits of paper, an X-ray or something like that, that becomes much harder. The information has to float around, and it's got to be discussed at different levels. It's got to be passed on to other people. In finance, there's got to be 2 or 3 people sign off on a particular mortgage, for example. And after a while, we haven't quite hit it yet. We're in the full flush of, let's get to work on, let's get our terminals out to our people. But eventually what will happen will be that the processes that are not working very well at the moment will really start to creak. So you've got risks on all of those dimensions you mentioned, Brian, people's process and IT.
Paul, you've got a particular constituency in terms of nursing. What problems are you foreseeing, what pressures do you foresee in the nearest future?
I think the biggest pressure we got is the people. You know, we represent nurses, you know, who are frontline staff, you know, who are going to be under immense pressure. And the focus for us as a business is to support those frontline staff and make sure they've got that support that they need. So obviously the pressure on us is to make sure that we've got that resource to do that, to support other people in what are unprecedented times and is simply going to get worse. That's the biggest challenge for us, I think, is that ability to be able to maintain that support, to give that guidance and to be there for the people who are in the front line.
Thanks, Paul. What's your take on that, Stephen? Near future pressures?
Yeah, completely the same. So it's definitely going to be all about the people. How do we make sure we've got enough rotas in place? How do we cover absences of key people? And I think a little bit unlike snow or stormy weather or something else which might keep people away for a couple of days, I think there may still be an expectation from organisations. This is going to be a bit like that, and everybody will be back again by next week. And that's just not the case. As Patrick's rightly pointed out, this is here for quite a while. And I think it's going to start biting on people over the next week, probably 2 weeks, that people will realise, actually, we're not going to see people for a long time, face-to-face, potentially. And that's going to be the biggest challenge, is all around the people.
Well, that has been very interesting. Let's conclude with a couple of thoughts on perhaps some lessons learned. As leaders, what do you consider the lessons you've learned at this very early stage to be? Could I ask you that, Paul?
I think the biggest lesson for us is test your business continuity plans ahead of the time, not when you're in it. Test. I think I've heard that so many times about testing people for coronavirus, but test. That I don't think there's any substitute for that, because if you're in it and you're ingrained and you're in that way of working, when the need comes, you're prepared.
Lovely. Stephen?
I completely echo that totally. And I think it's also in the comms piece as well that Paul mentioned earlier. We've got to be absolutely clear with people what our capabilities are as deliverers of digital services, and to make sure their expectations are realistically set. So there isn't that assumption that it'll just be on, it'll just work, because it may not just be on, it may not just work. So I think that clarity in comms is really important.
If you could go back in time and give yourself a bit of advice, say a month, just go back a month, Stephen, and give yourself a little bit of a tip for what's coming, what would you choose, do you think?
Other than purchase lots of toilet roll?
Yeah.
Well, it would probably be to continue to. I was actually having a bit of a battle locally about a month ago to get funding for office and things like that, to get that out to more of the organisations locally. And had I known, I would have been fighting even harder when I was up against barriers to investment. So it would be, don't give up on what you believe in, because it turns out it was right.
Yeah. Paul, same question to you.
I think the key thing for us is the desktop is dead. That mentality and that thinking of having a fixed location to work. We need to get people out of that mentality, and we need to make sure that people are able to work in as flexible a way as possible. So the phrase that I say is the desktop is dead.
Okay, that's excellent. So just the last question here then. When we're doing research for this, a little quote from JFK came up. The Chinese use 2 brushstrokes to write the word crisis. One stands for danger, the other for opportunity. As an amateur Mandarin speaker, I know that not to be true. However, the point is an interesting one. In a crisis, we're in the crisis now. What opportunities actually are there for learning from this? Perhaps new processes, new ways of interacting. Do you think, Stephen?
I think it raises quite nicely the importance of digital in the modern workplace, and perhaps that it hasn't been taken as seriously as it could have been or should have been in the past. And I think this is a great time for us to, apart from supporting and making everything work and keeping it all going, it's a great opportunity for us to showcase how well digital can support the organisation, so that when we do come out the other side of this, we're in a position to have sensible debates with our leadership where they are listened to now, and what our investments need to be moving forward, because this will probably happen again. And if it does, I think we'd all rather have done more of the testing, had more of the investment in more of the technologies and applications to make it work far more seamlessly in the future.
Lovely, thank you. Paul, what's your feeling on the potential for opportunities?
I think I completely agree with what Stephen's saying, around the raising of the importance of technology, just in general in terms of running your business, and the investment that needs to be made. We've all heard digital transformation. It means all things to all different people and various different things to various different people. But I think, this gives a brilliant opportunity to put the technology frontline and center of the organization, and to really make them sit up and understand that it's critical to your operation, and hopefully that makes it slightly easier to get that investment and focus in the areas that we need.
Yeah, lovely, thank you. Perhaps we can bring Simon back into the conversation. Simon, have we had any things that haven't been covered in any of the questions that have come in at all?
Yes, so thank you everyone for that really interesting discussion. We have got a couple of questions from the attendees. So thinking of cybersecurity, how should cybersecurity be prioritised during this time?
Or would you like to take that one?
I think as far as cybersecurity is concerned, I think this is an ingrainment in your organisation. It's how you work normally. So, from our perspective, this is kind of striped across everything we do anyway. And you shouldn't kind of forego that. But I do think there's obviously that challenge around accessibility, access to data, access to information, and securing that data, and it's getting that balance right. I think again that's a challenge, but for us, and certainly my thinking is that in everything that we do, it should always be in our mindset around cybersecurity. So I don't think it becomes a priority. I think it should already be there.
Should be woven in.
Absolutely.
Next question there, Simon.
Yes, so another question is, and obviously this is perhaps slightly harder to answer, but we'll go for it anyway, is how long do you see the possibility of staff having to work remotely? You know, it was originally thought of as kind of weeks, are we now into months, and kind of where do you foresee that going, and where have you kind of factored that in the short term?
I think that let's start with Patrick on that one. Patrick, you've got sort of overview of that. What's your reaction to that question?
One of the things that struck me about actually frightened me about the evolution of the pandemic is just how quickly it's become. It's actually come to the worst part of the pandemic, and I personally think around the world we'll be operating in this degraded mode for at least 6 months, possibly more, and it could be much worse. And I think what we have to be very careful about is not rushing to judgment. I agree with everything people were saying about digitalization, but I think 6 to 9 months from now we will learn some very good lessons about what to do and what not to do in this situation, and that must change the architectures and systems that we build in the longer term. So yes, we got to get over the hump for the next 3, 4, 5 months, but then I think after that there should be a period whereby we stand back and reflect on what was done well, what was done badly, what should be done well, and what do we not need to do. You know, let's simplify things rather than make them more complicated.
Thank you, Stephen. What's your feeling on that? The length of time that we're going to be in this change situation?
Yeah, I think Patrick's got it right. It's going to be that sort of length of time, and whilst for more office-based staff, the remote working is a possibility ongoing for, of course, clinical and care staff, nursing in particular. It's not possible. You have to be there with the patient. You have to be looking after the patients that we have. So it looks like there's going to be lots of delays to elective surgery and things like that, other than emergencies, obviously. So there will be a huge balloon of required surgeries to get through when we get to the other end of the sort of more enforced isolation phase. But in the meantime, it's going to be for lots of the support staff, those who aren't frontline carers, they're going to be going through periods of being rotated on and rotated off until they probably do become ill and have to step back for a period of a couple of weeks until they can rejoin the workforce. So it's going to have quite an ongoing impact, I think.
Yeah. Thank you for that. Any other questions there, Simon?
Just bear with me a second. There's just been one more that's come through. So do you think, as things currently stand, you've got the skills in-house to support you in this during this phase? And if not, how do we develop the skills needed potentially remotely over this period of time?
Good one. Paul, would you like to take that?
Yeah, I think initially at the moment, yes, we do have the skills. I do think there will be challenges around recruitment. We're already seeing that. But people aren't going to be looking for jobs at this time. So there will be big challenges around that. You know, if you have gaps in your team or gaps in skills or resource in your team, to fill those gaps right now, I think is going to be particularly challenging. I think that's where partners perhaps can help in terms of outsourcing some of that and working with partners to give that assistance. But I'm sure they will have their own resource challenges. But again, the other thing about is as Patrick mentioned, is about redirecting that resource where it can be used elsewhere. So really looking at holistically what you've got. And just making best use of that. And if you have those skills that can be transferred elsewhere into a more pressurized area, is utilising that.
Lovely. Stephen, what's your take on that?
Yeah, I think that pretty much says it, to be honest. Yeah, I don't think there's much to add to it.
Okay, that's lovely. Well, I'm getting the impression from the discussion today that Paul and Stephen particularly are quite pleased with how things have started, but very wary of the unknown nature of future things. Patrick's given us a very good sort of context and backdrop for these things. So can we say thank you very much to Paul Newman from the Royal College of Nursing, Stephen Slough from NHS Dorset, and Patrick McConnell. We very much appreciated your comments today.
Thank you.
You're welcome.
Thank you very much, everyone, and thank you all for attending. We will be sending out the webinar recording shortly after, so if there was any of your colleagues that you feel are going to get some good value out of this, please share it around. And also, if you've got any questions you didn't get around to asking this time, send them in, and we can look to pass those on and find some answers for you. So thank you very much for everyone for your time, and have a good rest of your day.
Thank you. Bye.